You're watching Hope and Courage, a tribute to breast health on ABC 27, brought to you by Penn State Milton S. Hershey Medical Center.
Welcome back. We know the statistics, 1 in 8 women will get breast cancer. A Dauphin County woman never expected to become part of that number.
That's a yellow truck. Look at so many trucks.
Chris and Howie Smith's world revolves around 19-month-old Josh. He's their first grandchild.
Oh, who's there? Mr. Bear. What's he say?
Chris embraces these precious moments because there was a time she wasn't sure she would ever experience this.
Doing a self-breast exam, noticed that I had a lump. Went in for my mammogram, and on my mammogram, they said, oh, we need to do an ultrasound. And I said, okay, that's fine. I've had that done before. I really thought I had a cyst.
But doctors weren't sure.
They said, no, I think we need to biopsy it. So I said, okay. I've had a biopsy before, no issue with that.
I keep thinking, well, when you have a lump, it could be it. And she wasn't worried. I was a little worried.
A few days later, Chris found out the results of the biopsy.
The biopsy showed that she had a cancer in her breast, the upper part of her right breast. You can see the area that we were concerned about up in this area where the circle is and so on. You have this bump that doesn't belong there. It's rather dense and it's asymmetric compared to the other side.
I was pretty much shocked because that wasn't at all what I thought.
Around that same time, Chris found out her daughter was pregnant.
One of my biggest fears in the beginning was when I was first diagnosed, here I am going to have my first grandchild and I'm not going to be around.
It's probably the only time during the whole process that she really broke down one day.
Chris's fears were put to rest once a plan was put into place.
I recommended the lumpectomy. I thought it would be easy to do based upon her MRI. It looked as though the size of the tumor was about an inch, maybe a little bit larger than an inch from the MRI.
I was really pretty set, like, okay, they found cancer, you take this out and I'll be fine. Whatever else has to happen is what happens.
The surgery itself, I don't think was the big concern. My real worry was, did you get it all?
Part of getting it all involved more tests.
Since 2005, we've been using a test called the Oncotype, which develops a recurrence score or risk of recurrence.
The Oncotype test looks at the actual genes in the tumor and can predict not only the chance of recurrence, but also whether there's going to be a benefit to chemotherapy.
She went on to get a Oncotype recurrence score, and her score came back at 27.
Chris had a test result that was kind of in the middle to high range. So when I met with her, I told her that there's probably a benefit to chemotherapy.
I was like, well, it's on the higher end of the middle. I'm thinking that means the chemotherapy is where I'm headed.
So Chris underwent 4 chemotherapy treatments. Dr. Cream told her what to expect.
You're going to go through your first course of chemotherapy, and probably within 3 weeks you'll start to lose your hair, and you're going to be really tired. Everything held true.
Chris's daughter is a hairstylist, and she knew what her mom needed.
She said, here's the wig I think would look really cute, and we're going to cut your hair to that style, and then once you end up losing your hair, it's going to look just like your wig and it's going to be fine. There's his phone. Go ding-a-ling-a-ling.
With months of chemotherapy and radiation behind her, Chris has a new look and a new outlook.
Where's a piggy? There's a piggy. I feel great. I really don't even think about it anymore. We had a grandchild, we've been busy, we're very active with him. I think life is good.
As you can see, Chris does feel great. Now, a year later, Chris's sister was diagnosed with breast cancer. She took the Oncotype test, and it was determined that chemotherapy would not benefit her. Alicia?
All right, Deborah, thanks a lot. Joining us now is oncologist Dr. Christina Tarica. Thank you for being here. Let's talk more about this test, this Oncotype DX test. Go through, what is this again, and how is this done?
So the Oncotype is a genomic test that looks at about 21 genes in the tissue of the patient with breast cancer and has the ability to predict the risk of the cancer recurrence and the overall survival for that specific patient. In addition, a more powerful tool is that it allows us to predict whether there is a benefit from chemotherapy or hormonal therapy.
And talk more about how this helps women, make decisions, important decisions that they need to make.
It does. The Oncotype basically gives us a recurrence score. The recurrence score can be low, and in that situation we have a lot of evidence that there is no benefit from giving chemotherapy, that basically saves the patient the chemotherapy treatment. The Oncotype, if it comes back as a recurrence score that is in the high range, then there is strong evidence that there is a lot of benefit from giving that patient chemotherapy. The more difficult situation is when the Oncotype recurrence score comes back in an intermediate range. For those patients, we do not have a lot of research and a lot of data as to whether they should get chemotherapy or hormonal therapy. We have clinical trials that have been completed, and we are waiting those results.
Okay, very good. And look, you do feel like there are certain patients who should get this test. Who are they?
This test right now is only being done in patients who have hormone receptor positive breast cancer. Also, for the time being, we have a lot of data only for patients whose cancer is not in the lymph nodes. We are working, however, on taking this test for the patients who are hormone receptor positive and the cancer is also in the lymph node, in the hope of saving some of those patients the chemotherapy as well.
And are there some other options for women when it comes to, chemotherapy or these hormone blocking agents? What else?
We do. So there is another type of breast cancer, if you've heard, called the HER2 positive breast cancer. And for that cancer, actually, we have a lot of tools nowadays. We have a drug called trastuzumab that has been shown to decrease the risk of the cancer recurrence by about 50%. So it is approved for the adjuvant treatment of those patients.
Dr. Tarica, thank you so much. And we'll be back with more questions right after this.